Good morning, everyone. Thank you for coming here today. I'm Claire Mahon, President of the IMNO, and to my right is Liam Dorn. I'm sure you're all familiar with Liam. I also have Geraldine Talty, First Vice President of the organisation, and Martina Harkin-Kelly, Second Vice President. We also have with us staff members Phil Hay, Edward Matthews, David Hughes and Elizabeth Adams. As you know, we're here today because we're just about to kick off with our annual delegate conference, where we'll have about 350 nurses and midwives here for the next 3 days debating various issues of concern to them. In general, they will be looking at pay issues and pay restoration. They'll be looking at working hours. We will also have much discussion on staffing levels and the workloads of nurses. We're all aware that the health service is in a crisis situation at the moment, and from a nursing and midwifery perspective, we really feel the shortage of staff on the ground. The workloads are immense, and our members are becoming quite frustrated with no movement from government to try and improve the situation. I know you all have copies of the press conference with you, and I'll just hand over to Liam to talk a bit further. Thank you.
Thanks, Claire. Good morning, everyone, and again, thanks for coming. I think Claire has touched on it really. I mean, we have 350 delegates coming, almost all of them from the front line who work there every day. And I think they'll come with a very heavy heart to this conference, based upon, despite the fact that miracles are worked every day in the health system by very hard-working staff, it continues to face intolerable burdens and intolerable challenges. The level of overcrowding in our emergency departments continues to grow. We've had the worst 4 months of a year to date since we started counting trolleys 12 years ago. We have lengthening waiting lists because of a lack of beds and a lack of theatre space. We have home care supports which are being cut back because of lack of funding and so on. And we can't expand and deal with those problems without addressing the recruitment and retention of nursing and midwifery staff. And we'll be releasing figures over the coming days about the actual level of vacancies in the health system, what that means to each shift in terms of frontline nursing staff and midwifery staff, and the failure to date. Despite some efforts, it has to be said, I mean, since we met last year, recruitment has gone on. But I think all the evidence now suggests that recruitment is failing to attract and retain staff. We're losing more people than we gain, even in hospitals that are doing their best to recruit. And the situation then means that we're very understaffed in emergency departments, in theatres, in medical surgical wards, in all acute areas, and continuing care, and in the community. Public health nursing is very, very severely affected by a lack of recruitment and a lack of available qualified personnel. So, as Claire says, we come working from a health service that is striving to do right, but is being totally under-resourced to allow it to meet the demands being placed upon it. And I suppose the last part of our opening comments would be that I think we gather today searching for evidence based upon the last 8 weeks that our political parties, in their discussions about forming a new government, get it in terms of the challenges facing the health system. It seems to have been very light in terms of the discussions on health, what needs to be done. And by the way, what needs to be done costs resources. We need additional acute beds, 1,500. We need 2,000 continuing long-term care beds. We need more public health nurses in the community and community RGNs. We need more consultants across the extended day. We need more allied health professionals to allow diagnostics to be available across the extended day. Those are the realities. You can't build a health service to meet capacity without building the workforce to meet that capacity. And we don't get a sense from what the government or the would-be government parties have said to date that health has really been understood by them. And I think that message will certainly come out clear over the next 3 days as well. And if the Minister comes on Friday, we're still expecting him to come, I think we'll be telling him clearly that we need a political consensus about a health summit that will once and for all put our health service into a situation where it is properly resourced, properly structured. And if ever there were a need to do that, I think in a way which all of us would want it to be, was the Irish Cancer Society study last week. If anyone really looked at that and really said to ourselves, how wrong is that? I think we should all be somewhat ashamed of ourselves. That money can now buy you life in terms of access to diagnostics for oncology services and so on. And that's not because the Public Health Service can't do it. It can do it to a world-class standard. It's just not big enough and large enough to deal with it. And a single-tiered health system is a centrepiece of our health policy that we're going to be launching tomorrow morning, funded by progressive taxation, and that it treats everyone the same, with your access only determined by need and not whether you have a health policy or cash or whatever. And I think last week's study was sobering, very sobering for everyone. So we gather there's a huge amount of good things happen in the health service every day, and nurses and midwives are at the core of that. But we could do so much more if we had political consensus and political goodwill to make the health service fit for purpose, so we end overcrowding, we reduce waiting lists for treatment, and we properly staff our care of the elderly and our community services, because that's where the action is going to be in the years ahead as we all grow older. And currently both community nursing and care of the elderly is grossly understaffed and is used as cost-saving areas by health management at the moment, with a very silent damage being done to patients and families and clients and so on. So that's the context in which we gather. 70 motions and 350 people coming. And I think they'll tell a very strong story about their role and how it could be improved if it was properly recognised and resourced.